You're not just getting old, you don't have a bad back. What happens in a lot of cases is, yes, you may have that back pain, but a lot of times it's an untreated mechanical glitch. It's something that can be treated and healed to stop that steal of your energy, to stop that steal of your athleticism, and to stop you from getting into pain every single time you go to be active. I'm Dr. Jeff Cumro, and over the past 15 years, I've been blessed to work with over 5,000 patients. And ultimately, through that time, we've learned a lot of things. And that's what we're going to dive into today is what can you do if you have lower back pain? And we're going to have a two-part thing here today. Next week we're going to talk about more of the upper back. Today we're going to focus more on the lower back because the lower back is kind of the foundation for this. And if we can get that lower back to work the way that it's supposed to, then that upper back a lot of times will go along with it. And I'm just moving some stuff around here on my board because we're going to draw a little bit today so we could get a little bit better idea of what's going on. So you're going to have to pardon my drawing because it is not the best, but we're going to make do with it. So we've got our person here. We got our hips here. So we should be standing like so. And what we should see is you want equal, well, you don't really want equal. We want balanced musculature to be front to back, left to right, top to bottom. And when we have that, we win. However, there are a lot of people out there because of the things that we do on a daily basis, all the sitting that we do, all the moving forward. So every time we walk, every time we run, every time we do anything athletic, as long as we're moving forward, we're strengthening those same muscles. What position are you in if you're working in a desk or a countertop or anything? You're working in front of you, right? So we end up with the front muscles being tighter in most cases, and this causes a mechanical disadvantage. So when we see somebody with lower back pain, it is very, very common to see them with a positioning more like this, to where you have a little bit more of an arch here. So it's not as straight up and down. And we don't want it necessarily perfectly straight up and down. Yes, when we look at the person's ear, it should be in balance with their hips. It should be in balance with their heels. But what we see here is you end up having the ear carried forward. It's more over the toes. It's not over the hips at all. And this causes a lot of problems. When we see that, we get the hips that are tilted forward. And what leads to this ultimately is a lot of the tightness that we get is here in the quads and here in the lower back. Now, oftentimes we blame our lower back pain on weak abs or tight hamstrings, right? Those are some of the biggest things. And some of those may be accurate. You may have weak abs. You may have tight hamstrings. The question is, why do you have tight hamstrings? Why do you have weak abs? Because our abs are something that should fire all day long, right? They keep us upright. Every move we make, we have to fire our core. If we don't fire our core, we don't stay upright. So why is your core weak? It's not because you're not doing enough sit-ups in most cases. It's because too many things that we do are balancing in this equation. This is called lower cross syndrome. It's something that most practitioners don't ever tell anybody about. It's something most people don't know about because nobody ever tells them about it. Instead, they're saying, hey, you have weak abs. I understand telling people that because you know what? People understand certain things. They're not going to, you don't want to tell them like the fancy medical name of different things because it doesn't do them any good. They don't understand some of these things, right? But when we look at this as a complex and when we actually explain what is going on, it makes a heck of a lot of sense. So as we start to see these areas tightening up, the pelvis tilts in a direction that brings that top forward and the lower part back because you pull this part down, you pull this part up, so it tilts it in this direction. That leaves these muscles and these muscles in a weak position, right? When you have this back here lengthened, and you do have that happen, right? Because as you start to raise this up, it pulls on those hamstrings. Those hamstrings also attach there. So as you start to pull on that, yes, your hamstrings are tight, but they're not tight because they are spasming. They're tight because they're fighting to constantly pull back down. So they're being stretched all the time. So ultimately, where we need to go with this is we need to start doing some exercises to get these things pulling downward more and get these things pulling upward more to counteract these forces and tilt that pelvis back to where we move that upper part back and that lower part forward. This brings us more into this type of a scenario, right? So the big question is, how do we do that? And first of all, like we should dive into this a little bit further. Why does this cause back pain? So as you start getting this type of scenario, when we look at the vertebrae, it's again going to be a rough drawing. Bear with me. We have our vertebrae, and they kind of stack together in some sort of a rough manner like this. We'll draw one more here. So as we start to push backwards, so when we start to get the tightness here and the tightness here, it brings our upper pelvis forward, right? So we start getting a little bit more force going forward here and backward here. So we arch our back and we end up, I guess I'll just draw another person here with an exaggerated look on this. So we end up looking like this. And we're really sticking our butt out. So that's a terrible drawing. Just ignore that one. Imagine somebody that walks with their butt stuck out. You can imagine that, right? So it's going to give us a better idea than this. You ignore that. That's terrible. But what we're doing here is as we start getting some of those forces, we get more of a curve like this than a curve like this. So that harsher curve will drive and push these together and push these together. And we get a lot of inflammation from that. We get a lot of pain from that. We get a lot of nerve information from that because these are a very, very nerve dense area. They are an area that is designed to send the brain signals of movement. So if we have any kind of irritation in there, it's constantly sending that signal up there. Something is going on. Something is wrong. And this is an important thing because if we get too much pressure here, we can have a pedicle fracture. It's a stable fracture, but it is a broken bone. And basically what you get is the body of the vertebrae moves forward and the back of it moves backward. And my mouse is not following with me here, so there we go. So it's a stable fracture. It opens up the spinal canal, so it doesn't cause any kind of paralysis or anything, but it causes a lot of pain because it's a broken bone still. It causes a lot of dysfunction in these joints. So it's something that's important. So what does our body do to prevent that from happening? We start laying down muscle spasms. So we get a muscle spasm from area to area, joint to joint, and that causes all of that to be compressed together even more. So over time, we get this inflammation pattern. We get this harshening of this extreme tightness back here. We get more inflammation. We start to get degeneration as these joints start to get a little bit more acidic. They start to break down. They start to, move in that arthritic position or arthritic direction rather. So what we are working to do is, again, move this lower pelvis forward, move this upper pelvis backward. And we could do that in two ways. We can work to strengthen the abs. What are some things that you can do? Great core exercises are your planks, something that's going to build that. If you don't know these exercises, just Google them. You could do any kind of crunches. You could do, you don't really want to do like leg lifts because leg lifts a lot of time are going to hit some of these muscles that are hip flexors as well. So leg lifts can actually make this worse. So you want to do things that are opposing to that, but you could get away with doing like hanging leg raises if you're capable of doing those and you have the equipment. The reason you can do that is you're bringing your knees up more and it will work to hit the abs a little bit more. But abs are not my favorite way to approach this. Why? Your abs are something that is firing all day. There's something that have some strength to them, but our hamstrings are something we can add more strength in a faster manner. So we can get this reversed more quickly, in my opinion, if we focus on the hamstrings and things that we can do on that. Romanian deadlifts. These are called RDLs. You can do glute ham machine if you have one of those at your gym. You could do leg curls. And there are a bunch of different varieties. You don't have to have a leg curl machine for this to happen. You can do some of them with a yoga ball or different things like that. So there's different ways of doing these exercises. And you can find ways of doing this. But the importance of this does not just lie in the lower back. And that's what we're going to dive into next week. So come back for next week's. But as we start to get this increase in curvature in the lower back, we compensate that with an increased curvature in the upper back as well. And that puts a lot of strain there. So this lower back, if we can get this to perform in the way that it's supposed to, not only is it going to help with some of these lower back issues, it's also going to help with some of those upper back issues. So again, ask your doctor before you do any of these exercises. And that is an important place to be. You've got to make sure that they're going to be safe for you. Stretching is going to be important. If you're focusing on stretching, do more of the quad stretches, do more of the lower back stretches, knees to chest. You can do some of like baby, oh man, what's the child's pose is what I'm thinking. Baby came out of there. So I don't know how that came up, but child's pose or knees to chest, you could do the one where you're pulling your, basically your heel to your glute to stretch your quads. There's different ways of going about this, doing some rolling or different things like that. But talk to your doctor. Make sure that it's going to be something that's safe. Make sure it's something that's going to fit you. But if we can get this complex working in the right way, not only does this help eliminate your back pain, it puts you in a position where your pelvis is balanced. And when your pelvis is balanced, it's going to help to bring back some athleticism. It's going to help to bring back some strength. It's going to help to keep you away from degeneration. So some of that arthritis production and different things like that, it's going to minimize the risk of that. But it's also going to help improve your balance. And that may not be important right now, but as you start to get older, as you start to age, that becomes more and more important. And it's something that we really have to focus on. So this is not just a plan for the right now, it is a plan for the long term. If you have any questions on this, reach out to me. I love talking about this. I could talk about this stuff all day. In fact, I do. So reach out to me if you do have any questions. I love and appreciate you guys spending your time with me. I know that that's your greatest asset. And I hope to catch you on next week's video as we're going to expand on this and move it into the upper back and how all of this plays together. So you have a great week. I'll catch you on next week's video.